Okay, so good morning and good afternoon, everyone. Thank you for joining our general call today. It gets us together as SBC practitioners for the malaria prevention and control and eventual elimination in all countries. Today is the first call in the year, and Happy New Year to everyone. I know it's a bit late, but we wish you a very good year. We are excited that about 444 people registered for this meeting, and it means that it's very important for the people. And tonight and for the rest of our call, we are going to go through understanding the community structures and how they play a critical role in the success of social and behavior change interventions. I'm excited to be having Danielle, Mubila, Deborah, Miko, and they'll be taking us through the day. And of course, as SBC practitioners, as we want to see effective implementation of interventions, we refer to our community structures. And you very well know that we look at social organizations, probably some networking organizations within communities. We look at institutions. All these form the social structures within the communities that help us to deliver interventions. And in the depth of this very presentation, we definitely understand the cultures. We want to be trusted. These structures act as communication channels. They help us in taking our interventions in terms of ownership, and they also help us in resource mobilization. So having said that, I would like to hand over the floor to Ashley to take us through the agenda and the rest of today's business. Thank you very much. And to our presenters, we are waiting to listen to you.
Wonderful. Thank you so much, Miriam, and welcome everyone for joining today's general call. As a quick reminder, please do take a moment to click the interpretation icon and select your language, either Portuguese, English, or French, to hear today's interpretation. And also, please go to the link on the slide, and here in a moment, I can put it in the chat to access the slides for today in English, French, and Portuguese. We have a very exciting agenda for today, quite full. We just had a welcoming from Miriam, our SBC Working Group co-chair. Next, we will go into some updates about the SBC Working Group Steering Group and a few other updates from me as the SBC Working Group coordinator. Next, we have a quick discussion on today's theme led by Gabrielle Hunter, followed by 3 technical presentations. First, we are joined by Miko from the Alliance for Malaria Prevention. Next, we're joined by Daniel and Deborah from the Society for Family Health in Nigeria to discuss engaging community structures in IT and distributions. And then finally, we have a technical presentation from Mubila at Pomo Plus, who will be presenting on the use of the Community and Faith Leaders Toolkit for Malaria SBC in Zambia. Finally, we will have a Q&A session moderated by one of our working group steering group members, Elizabeth, and a closing by Suze. With that, I will move into today's first topic, SBC working group updates. First, we have a few updates about our steering group. We have received some guidance from the RBM Partnership to End Malaria to update the way we speak about the working group and start calling the steering committee the steering group, as you've probably noticed in many of our recent emails. We had wonderful elections that took place from February 1st to February 15th. Thank you to all of our great candidates and to everyone who voted. And we are pleased to announce the new steering group member who will serve a 2-year term beginning this March, and that is Grace Maheso. Dr. Grace Maheso is based in Nairobi, Kenya, and she's the Chief of Party for Breakthrough Action Kenya, a social and behavior change project. If you can please take a moment, everyone, and congratulate and welcome Grace in the chat for starting her 2-year term this March on the steering group. Welcome, Grace, and congratulations. Of course, I would like to thank Ibrahim Asano for his wonderful leadership as our outgoing steering group member. Thank you so much, Ibrahima, for all of your work with the Francophone ambassadors and with the steering group over the last 2 years during your term. Everyone, please also help me thank and congratulate Ibrahima for a successful service in the chat as well. Wonderful. Thank you so much, Ibrahima. Next, I have a few updates about upcoming steering group elections. Later this year, the SBC working group will have two co-chair positions and 4 steering group positions opening for elections. Nominations for 1 co-chair position will open in April 2024, with voting beginning in May. The new co-chair will officially begin their term in November 2024, but this co-chair will overlap with our current co-chairs, Miriam and Gabrielle, from June to October 2024. This will allow plenty of time to hand over all of the knowledge and leadership to this new co-chair. The second co-chair position will open at the same time as 4 additional steering group positions, and those nominations will open in November 2024, and voting will begin in December 2024. The terms will begin in January of 2025. Please review the terms of reference for eligibility requirements, where they're very clearly described, and I will put that link in the chat here in a moment. With that, I will go ahead and pass it to Gabrielle Hunter, one of our co-chairs, to discuss today's theme, community-based structures. Over to you, Gabrielle.
Thanks, Ashley. Welcome, everybody. Let's go to the next slide. On behalf of the SBC Working Group, let's extend a very warm welcome to the Alliance for Malaria Prevention, or AMP, with whom we've partnered today to plan for today's webinar. For those who are not familiar with AMP, this organization is an alliance of over 40 partners from various sectors. Their mission is to expand the ownership and use of ITNs, and they do this through bringing together country and international partners in supporting the delivery of ITNs through mass distribution campaigns and continuous distribution. And to date, they have supported the distribution of over 190 million ITNs. It's a big accomplishment. And just like our working group, AMP maintains a very strong collaboration with the family of RBM mechanisms. AMP is also a sub-work stream under the Country and Regional Support Partner Committee, and have for many years worked closely with the Vector Control Working Group and also with our Social and Behavior Change Working Group. And that's why we're really happy to welcome them today, and we're happy to coordinate more closely with AMP, because we believe it's really important for the members, for our members to get to know each other more, both through this webinar and through future collaborations. Next slide. We do have a history of working together. I wanted to just recap that for those who are not as familiar. So with the AMP and SBC Working Group, we have developed a few resources together going back to 2018, where we co-developed, along with the Vector Control Working Group, the consensus statement on repurposing ITNs that specifically focused on messaging and actions to promote at the country level. And even though this resource was developed now several years ago, it continues to be referenced even recently. Even at our last annual meeting in Abidjan, there was some discussion about the guidance provided here. And then later on, during at the very beginning of the COVID pandemic, we worked together to develop the Malaria SBC program guidance in the context of COVID-19. And during our virtual forum, we had a really wonderful presentation in 2022 that Miko shared around some of the nuances and considerations around hanging new types of insecticide-treated nets and messaging and SBC around those new types of nets as they are increasingly being distributed by countries into communities. And then just recently, at the end of last year, we collaborated together on a short document making the case for malaria SBC. Next slide, please. Our collaborations continue. We have it, and it's quite important because our work intersects with each other in crucial ways. SBC is an integral part of AMP's activities, and ITN behaviors, the whole gamut of ITN behaviors, ITN acquisition, use, care, and repurposing, be it beneficial or neutral, is also central to the work of many of our SBC working group members. And this is a very clear area of overlap, how SBC is necessary before, during, and after ITN distributions in an area where coordination and collaboration among our groups can be quite synergistic and beneficial. And within that, both of our groups also work really closely with community-based structures. And we note that they are really vital to the work that our groups do. And by community-based structures, we are referring to community leaders, faith leaders, town criers, community health action groups, women's groups, civil society organizations, and more. These are structures that form the very fabric of communities, and they must be part and parcel of our malaria control efforts. And so through this collaboration, we wanted to really highlight this area of synergy between our two groups and go into a little bit more depth on what we can do related to those structures. Next slide, please. Oh, I'm sorry, Ashley. Could you go back one slide? Thank you. We also wanted to highlight how we're coordinating with AMP currently and in the future. So wanted to note that in addition to today's webinar, we attend each other's meetings and calls, and also we foster the cross-utilization of each other's SBC guides and tools and resources. And I just wanted to note, if you go to the AMP website, AMP has over 28 SBC resources that have been developed that are posted there and can be quite useful to SBC working group members. And then moving on in the future, we are delighted to work with AMP in updating their, as they take on updates to the AMP toolkit, and we'll be happy to contribute to the communication chapter and any other opportunities and ideas that come up. So, sorry, now the next slide, please. So I've covered this material already, so I'll just flash the slide for a moment. And then we'll move on to the last slide in my introduction of today's webinar. Next slide, please. Thank you. About today's discussion. So we'll share 2 actionable guides and 2 country-based case studies, one from Nigeria and one from Zambia, about this topic of engaging community-based structures, given how important it is to the work that we all do. And Ashley has already gone through the agenda and the names of our presenters, so I won't go through that here, just to say that we're really thrilled to have 3 different organizations who will be speaking about this complementary topic. And with that, I'll go ahead and hand the floor over to Miko Thomas from the Alliance of Malaria Prevention. Over to you, Miko.
Thank you very much, Gabrielle. So hello, everybody. Greetings from Melbourne, Australia. And perhaps to start off with, I have to say that I landed here a couple of days ago. I'm super tired. It is midnight here in Melbourne, Australia at the moment, so I hope that I don't slur my words too much and that you're able to understand me. I will do my best for that, I can promise you. So again, thank you, Gabrielle, and thank you for giving us the opportunity to join this call and to collaborate even further, as you were mentioning before, and we look forward to collaborating, strengthening that collaboration in the future. So what I would like to discuss with for the people that are on the call today is this guidance document that AMP has developed, which is called The Role of Civil Society Organizations in IT and Distributions. Next slide, please. Okay, so next slide, please. Sorry. So I think to start off with, I realized that not everyone will be familiar with AMP or the Alliance for Malaria Prevention. So I just want to give you guys a brief overview of AMP before we go on. Next slide. So AMP, as Gabrielle was saying, is a global partnership, and it is housed and chaired by the International Federation of Red Cross and Red Crescent Societies. And we do focus on 3 core activities: the coordination of partners that are involved in insecticide-treated nets, IT and distributions, the development and dissemination of operational guidance that are designed to support implement national malaria programs and implementing partners in planning and implementing their IT and distributions, and the direct support to national malaria programs and their partners through technical assistance in the planning and implementation of their IT and distributions. Next slide, please. So everyone is welcome to join AMP. Okay, so in the slides, you will find a couple of links to join the AMP mailing list, as well as to join the weekly AMP call, which is held every Wednesday. Next slide, please. Now, before I go on to talk about the actual guidance document, just to let you know that I am not going to give you a detailed description of the guidance and what is in the guidance. You will see that there might be quite a lot of information on the slides, but I'm not going to go through everything. And I'm not going to bore you by reading the slides out word by word. I just want to give you guys an overview of the objective of a guidance document. And then if you feel that this guidance document could be useful, you could use this guidance document, then please feel free to go onto our website and access it. Okay, next slide, please. So this is really one of the latest SBC guidance documents that have been published and released by AMP. It is a guidance with a set of recommendations, but like many of the tools that AMP has developed, it does have adaptable tools that will help national malaria programs and their partners in actually implementing the recommendations of AMP. This document is largely based on the experience of Nigeria engaging CSOs in IT and mass campaigns, and we will hear a bit later on from Daniel and Deborah about their experience. Next slide, please. So, I mean, I think first of all, it's important to define what CSOs are, and I think Gabrielle has already done that to some extent. This is a formal definition from the African Development Bank, but I think what I really like from this definition is this quote, that CSOs do comprise the full range of formal and informal organizations within society. And this can include, faith-based organizations, community-based organizations, local NGOs, National Red Cross and Red Crescent societies, etc. So as we see in this picture here, this is a local vigilante group, and they do comprise, this informal or formal organization within their community and contribute to the development of their community. Next slide, please. So the roles and responsibilities of CSOs within their community and in society is very varied. And so, but there's just 2 that I would like to kind of focus on in this presentation. The first is that they are advocates. They can really raise awareness around issues affecting their communities and challenges affecting their communities and really advocate for that change. They are also capacity builders. And this is very important because they're in a position to really provide education and training to community members based on the needs of the community. Next slide, please. So CSOs are definitely an asset when it comes to IT and distributions. Firstly, they are part of a community. They very likely are already known by community members and most likely are trusted by community members. They know the communities in which they operate, and they certainly know it a lot better than we at the district, national, international level who are actually developing that macro level plans. They will be within the community well after the campaign, and hence they can really contribute to sustainable SBC activities. And of course, they are usually community members themselves. So investing in CSOs will lead to stronger and more resilient communities. Next slide, please. So ideally, we would like to engage CSOs at all stages of a campaign, right? Whether it's planning, advocacy, social mobilization, or in SBCC, okay? Especially to ensure a more permanent presence in the community. However, and these are quite manageable and doable, but in reality, it is very rarely possible to ensure that CSOs are part of a planning process. Now, whether this is at the macro level plans, which is usually done at the national level, or whether it's done at the during the micro planning phase, which is usually done at the district level, because that requires mobilizing the CSOs to the district or the national level. And this is an incredibly costly activity. Next slide. So CSOs can be engagement either formally or informally. Informal engagement, this usually comes with a specific terms of reference and a budget. And as I had mentioned before, this is usually developed during macro planning. And it sets out the roles and responsibilities of CSOs in the campaign, which can usually include advocacy meetings, mobilizing households so that they fully participate in the campaign, SBCC, promoting positive IT and use care and repair behaviors, as well as building capacity in the community level. But they can also be engaged informally, if that is the case, then it doesn't come with a specific terms of reference or budget, but it would usually involve just asking CSOs to disseminate or message about the campaign through their day-to-day activities. Next slide. So what are the potential roles and responsibilities of CSOs? Well, in a formal engagement, firstly, CSOs really can be engaged to mobilize and further engage community and religious leaders at the community levels themselves. Okay, we know that community leaders play a critical role in ensuring they can play a critical role in ensuring that campaign staff have access to all households, and then can make sure that the households have access to ITNs. But to do this, they need to be trained. They need to be given the skills and the resources. And so this guidance document does provide a training guide that CSOs can use to train community leaders, as well as a job aid that community leaders can themselves use to implement their activities. Next slide. Similar, sorry, I hadn't noticed that the slide had changed. I told you guys I was very tired. So similarly to community leaders, I mean, school teachers, are really in a great position to help their students, to be efficient and effective agents of change within their households. But obviously teaching children is not the same as teaching adults. And I know because I have taught children in the past. But this is why the guidance document does provide a job aid for school teachers to help them, make learning about the ITN campaign and about malaria more fun for the kids, even if it's not such a fun subject, so that kids, can then be more effective in their dissemination. Next slide, please. They, of course, as I mentioned before, they should be involved in the social mobilization. So that would include perhaps the utilization of town criers, motorized street announcers, street theater drama. And we can see in this picture here, this is from Nigeria, actually, and it is a CSO that is having a community meeting and has mobilized the KK drivers in the city to talk to them about the upcoming campaign. Next slide. It is, of course, very important that the CSOs do supervise and monitor the activities, not only the activities that they themselves are implementing, but the activities that perhaps other community structures are implementing on their behalf. So the guidance document does provide these simple tools and checklists that are downloadable, but should be adapted to the local context and to what the macro plans and the micro plans have determined. Okay, next slide. Now, it is very important that if we are going to engage CSOs, especially on a formal engagement, their roles and responsibilities might be so varied and quite a lot. So it is critical that we train them, that we give them the skills, the tools, and the knowledge so that they can effectively carry out their roles and responsibilities. Now, the guidance, the training will depend on exactly what has been their agreed roles and responsibilities, but this guidance document does provide a suggested agenda for training of CSOs. Next slide. And of course, it is critical that we, the national merit programs and the implementing partners, are monitoring, are supervising and monitoring the activities that are being carried out by the CSOs. And that is to also provide them with the support that they might need to ensure effective implementation. We need to make sure that they are being provided with the necessary resources to carry out their function. And critical is that CSOs must report on the activities that they implement. And the guidance document does provide a reporting template that CSOs can use to report back to the district and the national level. This, of course, should be adapted to the local context and the macro plans. And I think that's it. Just next slide, please, just to make sure that this is my last slide. I'm pretty sure it is. It is. So I would just like to now pass on to my colleague, Deborah from Nigeria, from Society for Family Health, just to talk a little bit about their experience with working with CSOs in ITN distribution. Over to you, Deborah.
Okay, good afternoon, everyone. Thank you, Miko, for setting the pace. My name is Sesu Deborah Oyiman, and I am happy to be given this opportunity to present on behalf of Society for Family Health the experiences that we've had engaging with CSOs engaging CSOs for SBC activities in Nigeria. So please, next slide. All right, so before I dive deeper, I'd like to speak to us about the organization that we work with, Society for Family Health. We are a Pan-African NGO that was founded in 1983. And from inception till now, we have worked closely with communities, the government, donors, and private sector, for universal health coverage and social justice for all Africans So we have presence in 4 African countries as listed there: Nigeria, Ghana, Liberia, and Sierra Leone. And we boast of a workforce of about over 1,200 staff and consultants. Next slide, please. All right, so I'll be taking us through the roles and responsibilities of CSOs in the Nigerian ITN distribution campaigns. So first off, we start off this engagement with a formal selection process whereby CSOs that respond to our call for expression of interest are told or requested to send in a proposal, so that we use that proposal to kind of assess their capacity to actually implement activities at lower levels in the LGAs. By LGA, I mean local government areas. Those are like sub-state levels and the ward levels. So following that, we have a training of selected CSOs who during the training are equipped with the budget available. They are equipped with the scope of work, which Daniel will shed more light on, and the work plan, reporting templates. Their roles and responsibilities are also explained to them during the training, and their payment modalities are also shared with them so that they understand that it's not just paper-based payment, for example, but we use performance-based financing, which Daniel will also shed more light on. Yeah, so for the roles of CSOs, we expect that they work very closely with the LGA health educators. So those are the government eyes in the local government areas as far as SBC activities are concerned. And so because CSOs are like external to the government, we expect that they pass through the government structure and get the guidance and oversight from the health educators. And this is expected throughout the phases of the campaigns. That's the pre, during, and post phases of the campaign. CSO also have the role of conducting advocacy sessions and other activities, which during Daniel's presentation, he'll share more light. And then they are also to mobilize community groups to participate actively during the distribution of ITNs and during the registration phase, which comes before the distribution. And they're also expected to disseminate key messages about malaria and ITNs to communities. So the CSOs are responsible for ensuring that key stakeholders support the implementation of the campaigns. And this is very vital because once we lose the community stakeholders who influence community members to take up, positive net use behaviors, we really need their support, so we don't want to lose them. We make sure that we get their support during the campaign. And we're there to ensure that all communities within the local government areas are aware of the campaign and how it will be implemented. They are also to ensure that communities are mobilized to participate fully and safely. Remember during the COVID-19 period, we needed to incorporate COVID-19 preventive measures in our messaging. So ultimately, the CSOs are responsible for encouraging communities to adopt positive ITN use behavior, because ultimately we cannot be distributing nets and not promote net use. So the CSOs help us through the SBC activities that they carry out to achieve all these. So thank you very much for listening. I'll hand over to Daniel, who will take us through the nitty-gritties of the SBC activities. Thank you.
All right, thank you very much, Deborah, for that presentation. My name is Boyd and Daniel. I'll pick up from where Deborah stopped. So in line with the presentation from AMP by Miko, Society for Family Health in Nigeria work closely with AMP, and using the guide that Miko just presented, we decided to go a step further into that guidance by digitizing the activities of the CSOs. And these activities are the advocacies, meetings and mobilization with community and religious leaders, school-based activities. We also have town announcements and street announcements, and then union leaders meetings. All these activities are activities that happen during the campaign, in the pre, during, and post-campaign phases. What we did was to have ensure that all CSOs that are implementing are trained on the use of Kobo Collect app. They come with their Android phone, which is the bring your device strategy, and then we install the Kobo Collect app on their devices. What they are expected to do is, for every activity they are carrying out during the course of the campaign, they are expected to take the geo coordinates, geolocations of where those activities are taking place. And because we also want them to ensure that they cover all the community, we came up with this strategy where they take the geo coordinates of these locations. They also provide us the name of the head of the union, the head of the group, whichever group they are meeting for during mobilization. They also provide us with pictures of those activities as those activities happen. Next slide. So one major challenge or reason why we decided to digitize the CSO's implementation was to address the issue of geographical coverage. We realized that working with this document over the years, we discovered we wanted CSOs to cover all the communities, all the wards within the local government. However, it wasn't so clear to us if they were able to cover all the communities or all the wards which they are assigned to. And so the digital process enables us to also be able to track. We can see from the map, you can see all the activities that happen pre, during, and post, and the different activities, advocacies, meetings with religious leaders, traditional leaders, meeting with the school-based and union groups. These are activities showing the geospatial distribution of these activities within one of the states we implemented last year, which is Ogun State. So you can see the coverage, you can see the locations where we have buildings and houses and people living in those locations. You can see that they were fully covered, which actually is a sign that the digital mapping helped us to actually see the activities of these CSOs. Next slide. However, we also have some challenges working with the CSOs. Number one is limited funding and resources. The CSOs are local organizations, and the fact that the campaigns come with a limited budget, it makes it very difficult for them to continue implementation afterwards. But because they live in the community, they're able to just use the small, meager resource that they have within the community to continue implementation. So this limited funding is actually a challenge for us in our implementation. Another challenge is limited monitoring of implementation. The campaign happens within a short period of, say, 2 months, thereabouts. And then the number of demand creation staff on the campaign is also limited, which makes it very difficult for the campaign staff to have proper monitoring of the CSO's implementation, because this implementation happens concurrently across all the local government and wards in the state. As a result, we're not able to determine the quality in terms of messaging across board to say all CSOs are up to standard with the quality of messaging. And then another challenge is the diverse organizational capacities of this organization because they are within the local setting. Some of them do not have the capacity of others. And so it becomes very difficult to manage lower capacity, mid capacity, and higher capacity organizations in terms of communication, in terms of developing strategies, in terms of workforce that also implement the campaign effectively. Next slide, please. Yes, lessons learned. We discovered that there was increase in geographical coverage as a result of using the MP guide and introducing the digitization of the CSO's implementation. We're able to see increase in geographical coverage. CSO also have better understanding of the terrain and culture of the environment because they live and work in the environment, and so they're able to understand the distances, the culture, and all the socio-cultural activities that happen or affect the use of ITNs within their communities, and therefore they're able to address those challenges as they come. Community engagement or empowerment, CSOs are able to engage the communities effectively because they understand them better, they understand the local languages, the local dialects, they understand the local challenges or the health challenges, and also they also understand the issues affecting net use and care for the net, and so they create that empowerment within their communities. We also discovered or learned that community trust and accept their CSOs because they are people they see day to day. They are people that work within the community. And so there's this trust, especially for net use and care. And so another key thing we realize is that CSOs, because they are within the community, they are engaged within the period of the campaigns, they continue to implement or do some skeletal activities even after the campaign, that's the post ITN campaigns. Next slide, please. Oh, thank you very much for listening.
Thank you so much, Miko, Deborah, and Daniel, for sharing your experiences with community-based civil society organizations and ITN distributions. Before we open up for question and answer, we will switch gears and we'll hear from Mubila from the PAMO Plus project in Zambia, who will talk us through their use of the Malaria SBC toolkit for community and faith leaders and how they used it to mobilize faith leaders. So another aspect of civil society or community-based structures, but with a different group. So Mubila, the floor is yours.
Thanks a lot for this opportunity. Let me start by expressing gratitude to the steering team for giving PAMO Plus an opportunity to share the experiences that we are having so that together we can be able to learn lessons together and influence each other in the fight against malaria. So I'm here on behalf of PAMO Plus, the key members who are here, who made this presentation possible, myself, Mr. Kapasas Kazwe, Mr. Innocent Chansa, and Ms. Hazel Pande. And we also thank the steering team, notably Ashley, Gabrielle, and Elizabeth Chiende, who've been contacting us frequently to share experiences and be able to identify as worthy of adaptation of malaria SBC toolkit for community and faith leaders on PMI PAMO Plus. We can have the next slide, please. So this is what we'll talk about during these few minutes. The presentation outline is that we'll talk about the malaria SBC toolkit for community and faith leaders itself and how we came to pick it. We'll also look at the structure of malaria SBC toolkit itself, and also the process of training the community structures where the faith leaders and the community leaders will also share experiences in the value that we've seen so far in implementing it, and also the challenges and mitigation measures that we've employed. Also, we'll share some lessons that we've learned and also recommend few things with you. Next slide, please. Next slide. So to start with the background, I'll speak a bit about PAMO+ so that we are able to know what we are talking about. PAMO+ simply stands for Program for Advanced Malaria Outcomes. This is the project. So it's a consortium of 3 organizations, which is led by PATH, and other partners are JAPIGO and Zambia Center for Communication Program. Zambia Center for Communication Program being responsible of SBC, JAPIGO being responsible of case management. So this project is contributing to 2/3 reduction of malaria incidences and cutting into half the severe cases as well as malaria deaths. The baseline being the formative research which was done in 2018, as well as malaria indicator survey, which takes place every 3 years. So this project, the intervention that we do in the SBC to ensure that malaria comes down, we pay attention much to, we implement community engagement activities, interpersonal communication, as well as mass media. So on community engagement, part of the people that we see are the community leaders together with the faith leaders. So after making our strategy, we're looking at materials that we could adapt before considering making one. And we discovered that the breakthrough action developed toolkit was really fitting into what we're looking at, a thing that we can use to implement into the community. So this is the toolkit that we use to engage religious leaders who are gatekeepers in the community. So this has been the one which guides. Of course, we don't put much, our work is really to provide this toolkit to train the national structures, as I'll talk a bit deeper on it. And also the main focus is really to influence the faith leaders to their own strength, and also to network in the communities where they work in order to promote malaria elimination interventions. So the malaria SBC toolkit for community faith leaders adaptation, it uses the sacred texts so that the faith leaders are able to use their language and influence to help adoption of behaviors in the community based on the priority behaviors that together with stakeholders identify to be what we are supposed to promote in the community. Next slide, please. So what is the structure of this SBC toolkit for community and faith leaders? So this toolkit provides context on how leaders can influence their communities so that they are able to adopt those priority behaviors. And major behaviors, priority behavior that we are promoting through the toolkit is specifically correct and consistent use, care and maintenance of ITNs, insecticide-treated nets. Also, the antenatal care visits and uptake of a intermittent presumptive treatment. Prompt care seeking within 24 hours from qualified provider, and also acceptance of indoor residue spraying, which has been a problem for quite some time, which we want to eliminate in fighting against malaria. This provides guidance on its use. The toolkit provides guidance also on how to use it, especially on aligning values of those faith leaders and understanding audiences. And the identification of their strength, they do, they look at their strength and the assets which they have in order to use, because it's also shaped in ensuring that there is sustainability in the community. Whatever they do is sustainable. It also guides faith leaders on engaging other leaders and collaborators. They have to network with other facilities, with other structures which fight against malaria. They don't fight alone. They have to look at their contribution in the larger context. Next slide, please. So the process, what is the process of using malaria SBC toolkit for community and faith leaders? So what we are seeing is the process of what Permaplus does. And may I mention that Permaplus in Zambia, it's working in the 4 high malaria burden provinces of Eastern, Luapula, Muchinga, and Northern Province. And these are accounting to about 5 million, or slightly over 5 million people. So this is the process of how this SBC toolkit has been rolled out in Zambia. We start with the engagement of the CSOs. We heard earlier about how CSOs are useful in the communities against malaria. So Permaplus is also strategically working at building capacity in the civil society organizations, which are locally based in those 4 provinces I've mentioned. So through these subcontracted CSOs, the vision is that the goal is that they are the ones to be able to work together with the faith leaders in bringing together other stakeholders against malaria. So after these CSOs are engaged, the next thing is orientation of faith mother bodies at national level. These faith mother bodies are interdenominational structures which are identified by government. And I can state that government is really a major stakeholder here, because Permaplus as a project, it's responding to the strategy, the national strategy against malaria, which has 3 pillars. The first one being where malaria is high, it has to be reduced. Where it's low, it has to be eliminated. Where it's eliminated, we have to prevent the resurgency. So after orientation of the faith mother bodies at the national level, the next thing is orientation of faith mother bodies at provincial and district levels. So those who are oriented at the national level, they go together with the support of the project in the provinces to orient their leaders who are based in the provinces and districts. So the leaders who are in the faith leaders in the provinces and districts also from there go to roll the orientation to the structures we call the underliners. These are the faith leaders, the pastors, reverends, imams, priests, elders, and so forth at the community level who are running the denominations in the entire communities. So these also go on to now roll out the toolkit. So far, 640 pastors, reverends, imams, and other faith leaders have been oriented in malaria SBC toolkit for faith and community leaders, so that they are able to deliver the messages which are in the toolkit in their own places of worship. And they do this by sermons when they are gathering either on Sunday, Saturday, or Friday. homilies, and other religious gatherings, because other religious groupings have deliberately formed some health departments which are able to call their members at some points to talk about health issues. And malaria is one of the issues they are talking about. Next slide, please. So, orientation of religious leaders, what really happens at this orientation? So at this orientation, the faith leaders are identified, as I mentioned, by the faith mother bodies, which are recognized by government from all the faiths which are known in Zambia. So an average of 30 faith leaders are brought together in an orientation meeting for one full day. If the number is more than that, we'll split, because we believe 30 is a good number for facilitation, so that we are able to share experiences and for them to really understand the use of the toolkit. So these faith leaders are given enablers as they go to roll out, as I mentioned earlier. And these enablers are usually corporate shirts for their identification, the caps, and the toolkit itself. And this toolkit is usually given to them as soft copy on to put on their laptops and also on their phones, so that it's easy for them to have it. But in some places, those who demand for the printed one, the projects for now supports the printing and distribution of the toolkit. The faith leaders are asked to attend malaria stakeholders meetings because they are part of the key stakeholders. So whenever health facilities, health structures are calling for meetings, the faith leaders are not left out, so that they use every opportunity to disseminate malaria key messages. Next slide, please. What is the value that we are realizing for now? So the value of using the malaria SBC toolkit for community and faith leaders. So after having rolled out this malaria SBC toolkit, which was adapted from Breakthrough Action, the faith leaders have been equipped with correct messages, the messages which are scientifically proven, except they use their language of influence in their faith organizations to disseminate it. And this has helped religious leaders to amplify their unique role in malaria control. It has further also impacted skills on the alignment of religious values in malaria control. In the first place, they were not aware that they can take part in this. They were all about talking about the kingdom which is coming. But now they are also talking about malaria, and they are realizing that they have a stake in it. They have influence which can help eliminate malaria. So in addition, the toolkit has also equipped these religious leaders to further understand their audiences in malaria messages, because now they are conscious about it. They are able to identify which problem in which particular area of their constituencies. Leaders are able to identify and support their malaria program using their advantage, position, and influence. Suffice to give an example of the 2023 ITN campaign, mass campaign Zambia conducted. The 640 faith leaders took part, and they were really active in influencing households to register to receive those ITNs. So after the campaign was done, we were doing on-spot checks, and the random interviews that we were taking were showing us that all the people were registering, the people were seen. At least 6 out of 10 were able to say that they were influenced by faith leaders. They had messages of registration for the ITN campaign, as well as using the ITNs properly from the faith leaders at their particular faith bodies. Some faith leaders have integrated malaria messages in their services, and they provide announcements before sermons, before the divine services. They They provide announcements to promote adoption of behaviors for malaria control. Others have mainstreamed malaria messages in their church groups for women and youths. We saw it during the campaign. They took active role in distributing ITNs. Next slide, please. So this is just a picture which is showing some faith leader. It's showing the health facility staff who has been called at the church to speak about malaria, because the questions which were coming from the members, the faith members, needed technical responses. So the church had to come up with an initiative of calling the facility staff to come, and the Ministry of Health staff to talk about malaria. As we talked about, the toolkit encourages networking with other stakeholders in malaria elimination. So this is what the picture shows. We can go to another slide. Next slide. So what are some of the challenges and mitigation measures? As I said first, that it's work in progress. We are learning as we go to perfect our practice. So some of the challenges that we are finding are that initially, faith leaders expected remuneration for their role in community mobilization and engagement. Because we are in the third world country, when people see the people are coming from USAID, are sponsored by USAID, they expect that this is a job where they can get a payment out of it. So this expectation was managed through continued engagement and explanation of the role as part of their responsibility to promote good health for congregants. And some of the mother body leaders took part in making the faith leaders on the ground to understand that this is their responsibility. They don't need that payment. And also for sustainability sake, they are being supported to be able to talk against malaria. And they were able to be explained to about how malaria is affecting their congregations, which they came to understand and embrace with continued engagement. Also, introduction of review meetings which provided some transport refunds and lunch also helped to manage this expectation. So these review meetings comprise other stakeholders, facility staff, and other players against malaria. They are brought together with faith leaders to speak about their experiences, and the faith leaders will talk about the use of the toolkit, what they're encountering, the challenges, the lessons they're learning, so that they inform the management of the coordination of the services against malaria. Also, printing of the toolkit for community and faith leaders, for these faith leaders, is costly. As a result, most of the faith leaders, as I mentioned earlier, were given soft copies for use on their phones and laptops. So this is how we managed it. Of course, in other areas, the internet is very poor. So we've encouraged them to put on their laptops and their phones. Also, quantification of audiences has been challenging. We may not give numbers of how many people have been met in a particular week, because most of these congregations do not really register how many people came to their congregations. It's an open system where people come to church, people come to the mosque, they are not registered, they are going back. So this is proving as a challenge as to account for how many people are being reached to with the messages through the toolkit. In addition, getting feedback on activities is challenging due to inadequate formal linkages of religious leaders with the health system. Of course, they come for these meetings, but formalization of them reporting to the health system is not yet solid for us to be able to track what they do from the Ministry of Health. In 2024, PAMO Plus has planned to leverage quarterly review meetings as a platform for obtaining feedback. In these review meetings, they will be able to be giving us the number they've reached out to, the challenges and everything, so that even the Ministry of Health is able to take some of the numbers from them. Next slide, please. So talking about that picture there, it's about the review meeting taking place. We can go to the next slide. So what are the lessons that we've learned so far and recommendations through the use of toolkit? So what we are learning, we can go to the previous slide. So what we are learning is that orientation of faith leaders to malaria SBC toolkit provides guidance for correct messaging. They are now giving the messages which are scientifically proven, not just speculation. And also sincerity, openness on the role of faith leaders, coupled with continuous engagement, helps to manage expectations. So through the continuous engagement, we are learning that their expectations are being managed and they're embracing the work against malaria. What are some of the recommendations that we can share with you? There is need to effectively and formally link faith leaders' activities with health system to capture the reach. Going forward, it will be good if their work can also be on the DHIS too, so that they're able to enter data which can reach the Ministry of Health. So these are some of the things we are looking forward to. Also, feedback mechanism is critical to learn challenges and best practices. So we are recommending that the feedback mechanisms like the review meetings and others which can come as we go on are very helpful in being able to share the best practices. Collaboration of faith leaders with other community leaders like village headmen and also innovation. These are some of our recommendations. So the picture you are seeing, the faith leaders who have come together to share experiences. Thank you very much for the opportunity. I hand over to the conveners to
Thank you,
carry on.
Mobila. I'm really unfortunate that we have gone over time. We do apologize for that. That's unusual for our group. So apologies that we don't have time to have a live question and answer discussion as we normally do. However, I'm very grateful to the presenters who were able to answer some of the questions directly in the chat already. Thank you for that so much. We will need to move into closing today's webinar. Clearly, this is a very important and rich topic. We had so much to discuss, so we'll need to continue the conversation. These are the ways you can stay in touch with the SBC working group. And earlier in the chat, our colleagues from AMP also shared how you can contact AMP to stay in touch and participate with them. With that, we will close out today's meeting. Do stay tuned to receive the recording of the call, and so that we can you can recap anything that might have been that you might want to look at again. Thank you so much to our presenters today. Thank you to all who joined us for being patient with us as well. And apologies again that we went over time, but thank you so much for the rich conversation. Have a great rest of your day, all.